Hello, this is Dr. David Green, CEO of the Texas Pain Network. Today's topic is what you need to know about facet injections. The facet joints are small thumbnail-sized joints located on either side of the spine at every level from the neck all the way down to the sacrum. These joints include cartilage just like the hip or the knee, and they combine to allow for an incredible range of motion of the spine. So you can see, looking from the back of the spine, there's a facet joint here, 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 here. So they really do go all the way up and down. Now, what makes a facet joint painful? They are small joints, but they do have cartilage, and they are prone to arthritis. And even though they are small, they can cause an incredible amount of pain, even in just one joint. Now, typically, it leads to pain in the vicinity of the arthritic joint, but usually where there's one, there's several. Now, here's an example of what you see. Here's a clean-looking joint, a facet joint. When it starts to get arthritic, you start to get overgrowth of bone spurs, overgrowth of soft tissue, and it can irritate these nerves that provide sensation around it and cause pain. Now, for symptomatic facet arthritis, there really isn't a great surgical answer. There are excellent non-operative options. Facet joints are just one of them. So essentially what happens is you put a needle right into the affected joint and inject numbing medicine and steroid, just like you do for a steroid injection into any joint. It's an outpatient procedure. It only takes 10-20 minutes. Modern pain doctors do use fluoroscopy or some kind of image guidance so they can see exactly that the needle goes into the joint. A lot of times pain doctors will inject some dye to ensure that they're in the joint. Usually you don't need IV sedation to do this type of procedure. The skin's numbed up, the soft tissues are numbed up down to the joint, and then several levels can be treated at the same time. And you can repeat the procedure just like you can any steroid injection every few months. How well do they work? 82% of patients receive pain relief over 50%, and significant functional improvement was seen in over 3/4. And that's with or without steroids, so even if you're just using numbing medicine. The average duration of pain relief with facet injections is 15 weeks, which is over 4.5 months. And the same results have been seen in numerous studies. The procedure is an excellent non-operative method of achieving neck or back pain relief due to spinal arthritis. Well, what happens if the pain comes back? There are three treatment options at that point. You can repeat the facet injection, you can do what's called a medial branch block, or move on to a radiofrequency ablation. So these little nerve endings are the medial branches. So if you don't go into the joint with the needle, you can actually put it around the joint and numb up these little medial branches and alter the way the brain perceives pain signals for months at a time. The radiofrequency ablation shown here deadens these nerve endings, and that can provide pain relief for 18 months, 12 to 18 months. The risks involved with these injections are very, very low. There's a slight risk of infection, bleeding, allergic reaction. The needle doesn't go into the epidural space, so there's no risk of a nerve root injury unless the doctor is way off course with the needle. You're outside the spinal canal completely with the injection. The top non-operative pain management in Texas is through the Texas Pain Network. There are several clinics throughout the state accepting over 50 insurances and providing over 25 treatment options. The average success rates with the board-certified award-winning doctors exceeds 90% on average. Visit us online today at texaspainnetwork.net and then call us for more information and scheduling at 877-877-8556. I'm Dr. David Green with the Texas Pain Network. Your pain stops here.